Sneezing is an involuntary expiration of air to rid the nasal passage of foreign material. Particles that enter the nostril and irritate the nerve ending in the nasal mucosa triggers the impulse that are transmitted by the fifth cranial nerve to the brain sneezing center in the medulla. This sets off a respiratory response. Rapid inspiration fills the lung, the epiglottis and the vocal cord closes, and the muscle of acceleration in the chest and the abdomen tightens in a spasmodic contraction. This event creates a build-up pressure in the lung. When a sufficiently high level of pressure is attained, the vocal cord relaxes, the epiglottis open and expulsion of the air rushes through the nose and mouth. Force of the sneeze propels the irritant out of the nasal cavity.